Good morning and welcome back to SIROWORLD 2016. I'm your host, David Temple, but I should change my name to Jay because I'm here with Dr. Jay Reznick and Dr. Jay Black.
Just Jay Black.
I know, but I like to call you doctor because you're a doctor of laboratory. We're talking labs today, and why don't we get things started with, I'm fascinated by 3D printing, just in general, and now you guys can do 3D printing.
In the office.
In the office.
And that's, that's been an incredible advancement in this whole process of guided implant surgery. When I started with Galileo's 7 or 8 years ago, we would do the treatment planning, upload the information to CCAT, and it was almost 2 weeks before we got the guide back. And so patients came in, we always had to plan around that, but if someone came in with an injury, let's say they fractured off tooth number 8 at the CEJ, or subluxed the tooth and you wanted to take the tooth out and do an immediate implant, you would have to put the patient off for a week and a half to 2 weeks.
Right.
Now with the technology with digital guide, I actually had a case just last week where I got an email from a patient's boyfriend on Sunday evening saying his girlfriend was in a car accident earlier that day, or earlier the afternoon, and lost a tooth, had some teeth pushed in, and could I see her? He knows the office didn't open till morning, but he wanted to try to see if we could get her in. So I said, sure, bring her in Monday morning. She came in Monday morning. She had lost tooth number 7, completely gone. Teeth number 8 and 9 were pushed in, subluxed with an alveolar fracture. Did my digital workup with my CEREC, Omnicam to do my optical scan, so we didn't actually have to take an impression, which would have been difficult with the loose teeth.
Sure.
Did Galileo scan, did my implant planning to replace tooth number 7, which had been lost the day before, uploaded the data to CCAT at lunch. Okay. The next morning at 5 a.m., I wake up at home, I log into my computer at the office, download the STL file, send it to my 3D printer, start printing the guide before I get in the shower at home. When I arrive at the office, the guide is done printing. Patient comes in for 8 o'clock, fully guided implant surgery.
Look at this.
I mean, incredible. Less than a 24-hour turnaround.
I love it.
Yeah.
I agree. Everything now is about speed and accuracy, and especially having a laboratory where I work with multiple CEREC dentists. Literally, all they have to do is design the guide, send me the CMG DXD, and with the in-lab MCX5, we can mill multiple implant sites very fast and have them back to them the same day if they need it.
Yeah, I mean, it's so easy, so accurate,
easy.
And and to actually mill the guide or print the guide at the office and get it ready to go, because it comes off a little bit rough off the printer. You've got to do a little bit of smoothing and put the drill sleeve in. It takes 5 minutes. So, I mean, this is absolutely incredible. And, of course, we have the CEREC 2 guides where you can actually mill it in office right then and there, is even more amazing. But as this technology improves, we're going to be doing it. I mean, I can see the day where I can create the STL file directly in my Galileo software and print a surgical guide, immediately. And the patient can come in at 8 o'clock in the morning for a consult, and we can do the implant an hour later, fully guided, with a provisional.
To say that it's
provisional.
Game-changing seems cliche, but it really is.
Oh, it really is, yeah.
Yeah, now there's no reason not to do a guide. I mean, we should do a guide for every case if possible.
Yeah.
Because as a laboratory, we used to get cases where implants were not placed properly, but now with a guide, we can restore the dentist cases if they're not doing them themselves at their office a lot better.
And that was my next question was, so if a doctor is backed up or jammed up or doesn't have the wherewithal of the materials or whatever, they call you and you're...
Yeah, exactly. They can call any in-lab lab and send us the CMG DXD. We can go ahead and mill it out for them. If they're backed up or they have other things they're doing, we can go ahead and be their support.
See, that's why I call you Dr. Lab. That's it.
Yeah.
What do you find yourself thinking? What can possibly be next I mean, if we've compressed time this much in just how many years have you said now?
I've been doing this for, I think, for almost 8 years now. I mean, I had one of the first Galileos units in the country. I've been doing fully guided surgery for probably the last 7 years. It's 99.9% of my cases. There's an occasional, patient that I do freehand, but it's pretty uncommon. And so I've done probably thousands of guided surgeries, and I'm just amazed by the accuracy and the efficiency with which the implants are placed. I used to schedule a case, let's say I'm doing 3 implants. That used to be a 1-hour block in my office. Now we can schedule this as a 30-minute procedure, and we're done in 20 minutes, start to finish. Every implant is absolutely perfectly positioned, perfectly spaced, and the beauty of it is that it's restoratively driven. So my implant planning is not decided by when I flap it open and say, well, it looks like the implants go here, here, and here. It's planned based on the final prosthesis, planned by the restoring dentist, by my referral. He tells me where the crowns are going to be. I decide where the implants need to go for that. I develop the site if I need to, if I need a graft bone. I have the guide made, and the implants go in exactly in that spot. They get the case back, and it's perfect every time.
Wow, you've answered every question I was going to ask you. So, what have you found, perhaps at this convention, that you didn't expect? Something you like a happy surprise? Has there been any?
The food's been good. Haven't had actually a chance to walk around a whole. I've been pretty busy since I got here. But I think one thing that I've been impressed with is as I've been through the different CEREC events through the years, since CEREC 25 was my first one, is the number of other vendors that are here and other technologies that are coming into the fold. And of course now with the merger of Dentsply and Sirona, it brings in a whole new aspect into the digital realm. They're bringing their expertise from the implant side and the supply side, the imaging side's coming in from Sirona and CAD/CAM, and together this is an incredibly powerful combination that I think we definitely are going to be directing where this technology and where dentistry is going to go for the next 50, 100 years.
Jay, you think same?
Same thing. Every year that I come to these events, it's amazing just how much more stuff we have, how much more stuff the labs can do, how much more the dentists can do, the surgeons can do. It's always just unbelievable. Like, I'm so glad I got into digital when I did, because I mean, it's changed the way our lab is. Our lab wouldn't be here if we didn't have digital right now.
One of the dentists said yesterday, said he's so glad that he's practicing now versus, 50, 100 years ago, because the advancements are so profound.
Yeah. Well, actually, I was putting together one of my lectures for tomorrow, and it's on CEREC provisionals in the surgical practice. And my first slide is, I spent 8 years in medical school and surgical residency so I would never have to do another restoration in my life. What happened? And I never would have thought, with the way that I was taught and the way technology was, even 2 years ago, that I would be having CEREC in my office, milling out provisional restorations, custom abutments, and even final abutments and provisional crowns for my patients. And it's changed the way we do things. We can do, an immediate provisional on the implant that's placed at the time the tooth comes out, and it's going to fit perfectly. I can choose the occlusion. When I've had cases sent to the lab, and I ask for it out of occlusion, light interproximal contacts, hopefully I get that, but I usually end up having to do some adjustment. When I do the planning in CEREC for my provisionals, it's exactly the way I want it to look, exactly the way I want it to be.
Love it.
And it's perfect. And of course, with the surgical guides, the implant placement is absolutely perfect. So you can even have the provisional made ahead of time, and it's going to go in with zero adjustment.
That's it.
Which, as a surgeon, I love.
Yeah, exactly. Well, guys, thank you. I know you've got places to be and things to do, so thanks for joining us this morning.
Thanks for having us.
All right.
Thank you.
And we'll be back with more SIROWORLD 2016 right after this.